Spinal Truth Show, weekly podcast edition. I'm your host, Dr. Caleb Slater, joined by Chris, Master Orator.
Master Orator, a man who has...
Two wrists.
Two wrists, two hands.
This week's episode is about carpal tunnel or symptoms into the wrist and hand. Before we get to that, make sure to like and follow us on Instagram, TikTok, YouTube, and we are also on Spotify.
We are on Spotify.
We're not even doing Facebook anymore. We're just saying
probably for the best. Probably for the best.
All right, so carpal tunnel, Chris.
Yeah.
That's this week's topic.
It's a topic we've talked about before in the past, but I feel like a lot of people struggle with carpal tunnel symptoms.
Yeah, and it is not carpool tunnel.
Is that what I said?
No, but I get it. Well, I mean, that's phonetically it's carpal tunnel, but it's not Carpool tunnel.
There's a lot of things in the back end of Spinal Truth that I have to do, scheduling videos and stuff. And do you know how many times I had to Google how to spell plantar fasciitis? And a couple other symptoms.
Fasciitis is a tough one.
That's a hard one.
That's a tough one.
How many C's, how many I's? We're just throwing them in there. Yeah. Carpool, not carpool tunnel, carpal.
Carpal tunnel.
Yeah.
So, all right. So carpal tunnel, for those at home, is an irritation in the median nerve. The median nerve is a nerve that comes out of your neck. It's actually multiple nerve roots, so multiple levels of your neck come out and they converge into one nerve. Mm-hmm. And then that nerve travels down your arm, down through the carpal tunnel. So the carpal tunnel is an anatomical site, like you driving on a road through a tunnel. That tunnel is a structure.
So it's also the name of the structure, yeah.
This is the name of the structure in your wrist, the carpal tunnel. The bones in your wrist are called the carpal bones.
Okay.
Right? So they, plus a ligament, make up a tunnel.
Yep.
Okay? That nerve travels through that tunnel. If that tunnel closes down, you get pressure on the median nerve, and you get carpal tunnel syndrome.
Bam.
But that is almost never the cause of your symptoms.
Everybody has carpal tunnel. Do you know how many people, like in the past, I've heard, my carpal tunnel's flaring up. Anytime wrist pain, yeah.
All right, and when you hear, like, when you have somebody that says they have carpal tunnel, why do you think you get carpal tunnel? Like, if you didn't look it up.
Sitting at a computer, typing, using the mouse.
Yeah, and that's the problem, because that's correct, and it's also inaccurate at the same time. Yeah. So you do get it because you're sitting at your computer desk for a long period of time, but you don't get it because you're resting your wrists on the desk, or because you're constantly typing. It's because you're sitting. It's the position your neck is in, your spine is in, not your wrists are in. And that's why you're getting your symptoms. That's why you're getting them, and we'll explain this in a little bit, that's why you're getting them at rest without like a lot of like heavy use, right? That's why you're not getting recovery with the treatment at your wrist, because it's not a wrist problem. And there you go.
So is carpal tunnel syndrome still a legit thing? That you can have a collapse?
It is, and you can have a collapse, but it is much more likely that you have pressure on that median nerve closer to your neck at the nerve roots, right? Versus at your wrist. Additionally, there's something called a double crush phenomenon, basically meaning that any amount of compression along that nerve can cause symptoms, and often there's multiple sites where there is compression at the nerve. And it can be an aggregate effect. You have 3 different areas with, just to make this easy, 10 pounds of pressure on this nerve, and that's causing symptoms. But more likely, the closest compression at the neck is what's causing the symptoms, or leading that nerve to be more susceptible down at your wrist, where the pressure that it's getting at your wrist wouldn't elicit symptoms if it didn't also have concurrent pressure up at your neck.
It's like an additive.
It's an additive effect.
Okay. Legitimate carpal tunnel. How does someone get legitimate carpal tunnel?
All right. You can get inflammation in the wrist. Anything that closes down the carpal tunnel,
right,
would cause carpal tunnel syndrome. It could be a bone spur pushing on the nerve. It could be some inflammation in the wrist. It could be the carpal bones shift over time due to like ligamentous laxity. And this could be because of tearing or overuse or something like that. That's probably the main reason you get carpal tunnel.
So when you go to your doctor and you have wrist pain, do they do an MRI on your wrist, or how does that work?
So most of the time for carpal tunnel, people actually get what's called a nerve conduction velocity EMG test. So you get a shock through your nerve and you get a shock through your muscles, or you get your muscles tested to see if they're conducting electricity, if they're contracting.
Okay, and based on the results of that test, they'll say you have carpal tunnel.
Yeah, most people, they'll get the diagnosis without that. A lot of them will get that. Very rarely do they also get imaging on their wrists. If it is, a lot of times it's ultrasound, which isn't quite as good.
Gotcha.
And very rarely will they get some type of imaging at their neck. But again, we've talked a lot about this. Imaging's a lot more misleading and inaccurate than most people realize. It's taken in a position of comfort. You can have multi-level nerve tension that's not seen when you're lying down. And this actually applies too for the nerve conduction velocity test, EMG, that you would get. So there's a few flaws in it. The biggest is that it doesn't detect nerve root compression.
Okay.
Okay, so that's a really big flaw for this. The nerve conduction velocity tests are much better at finding peripheral, so further down the line compression at this nerve.
Will it see the nerve signal becoming weaker further down it goes?
Well, it's supposed to.
Gotcha.
Right, and it's supposed to pick up on segments where it's weaker and stuff like that. But again, like if you're testing further away from the injury site, you're not going to see that change. Also, too, you're testing it, you're normally comparing it to normative data / the other side. And if the other side's affected, you're not going to tell the difference.
And if it's potentially a neck problem, you could have it on both sides.
Often you have it on both sides
so,
if you have a neck problem.
So you wouldn't be able to tell much of a difference then,
Correct.
Right? Gotcha. Yeah, that is a pretty big flaw.
And then also, too, with like chronic low-grade nerve issues, it's less detectable on these tests. And a lot of patients, that's what they have.
Gotcha.
Thank you for watching the Spinal Truth Show. I hope you're finding this information helpful. If you're out there and you're still in pain and you're looking for relief, we have some solutions for you. You can schedule a consult with me or a session, but if that's not in the budget, we also have some options that are self-guided at home. You can go to thespinaltruth.com. We have courses set up right now for arm pain as well as for neck pain. They are geared towards you. They are a 4-week course, 60 videos that are self-guided by an expert in the field that you can do from the comfort of your own home at your leisure. They will take you through step by step the typical approach that I take with patients. The expectation is that they will provide significant relief over these 4 weeks. So if you're looking for something better, something different because you're not finding the relief, go to thespinaltruth.com, sign up for one of these courses, and get the right treatment, see the difference.
Okay. I did find it interesting, like you would think if you have legitimate carpal tunnel collapse of that area or whatever, an image would show that, no?
An image would, but remember that collapse could cause carpal tunnel syndrome or could also not cause carpal tunnel syndrome. So like the best thing is to go by your symptoms, your location, the behavior, symptoms, stuff like that. And it can make it relatively easy for people at home, right? We've talked a lot about this, but there's a few signs that really point to your neck and not to your wrist.
Okay.
All right. One of them is if it's on both sides, right? If it's on both sides, it's more likely a neck issue, a pressure on a nerve at your neck that's causing both hands to hurt.
Two carpal tunnels. Yeah.
Two carpal tunnels versus both collapsed at the same time.
Yeah,
that makes less sense.
Yep.
Okay, so all right, we're in agreement with that, right?
Yes.
Another one is if it's in your pinky. Okay, if it's in your pinky, if you have symptoms, pain, numbness, tingling, weakness, whatever, in your pinky, that is not carpal tunnel. The median nerve, which is what gets compressed at the carpal tunnel, does not innervate your pinky. That's your ulnar nerve. That's your funny bone.
Interesting. Wonder why that is.
Why is that?
Yeah, like that's an interesting choice made by evolution there.
Just the pinky? Well, and how about this? Your ring finger is innervated by both. The outside half of your ring finger is the median nerve. The inside half is your ulnar nerve.
All right, that's cool.
Yeah.
Can you ever like just lose the feeling of just the pinky or something like that?
Yes.
And then it just kind of dangles there, goes along for the ride, I guess?
You can. It actually happens a lot in the feet.
Oh, okay.
That's why people, like, when they're walking, you'll hear them, like, smack their feet. Like,
okay, because they just don't.
It's called foot drop. The L4 innervates your tibialis anterior, so it's the muscle on the front of your shin. And it's the muscle that's basically in charge of bringing your foot back and slowly lowering it down. So if you don't have that, it just flops down.
Interesting. All right, so both sides, if it's in your pinky, what else?
It's in your pinky. And despite it being in your pinky often, you'll still get diagnosed with carpal tunnel. Like, doctors will miss this. If you're getting your symptoms at rest, if you're just sitting there, you're just lying down, if you're looking at your phone, if you're sleeping, if you're driving your car, if you're sitting in class, if you're sitting at your computer and you're getting your carpal tunnel symptoms, it's most likely because there's compression on a nerve, right? I mean, that is what causes carpal tunnel. It is much more likely that that compression is happening at your neck at rest than at your wrists.
Yeah, because if you're not putting any pressure or
Not putting any pressure, you're not
why?
really using them, you're not, right? Like, all right, so there's 3.
Yep.
Another one, kind of like the pinky, is if you have symptoms outside the area that's innervated by the median nerve from the carpal tunnel down. All right, so to make this easy, if the median nerve innervates your thumb, your index finger, your middle finger, and the outside half of your ring finger. That's pretty much the only areas you can have your symptoms. If you have anything in your forearm, anything in your elbow, your shoulder, your neck, that is not carpal tunnel. Absolutely not carpal tunnel.
Because carpal tunnel
just goes down.
There and down.
Yeah.
So if it's above that.
Your body pretty much works down and out. It goes brain, brainstem, spinal cord, spinal nerves, down and out. For the most part, to make that easy, that's the way your body behaves.
Gotcha.
So if you have pressure in the nerve at the carpal tunnel, it's only from there down where you'll have symptoms, not higher up.
Okay.
Most people have symptoms higher up. Most people that get diagnosed with carpal tunnel should be sitting there saying, well, I have a few of these, not just one of them, right? Because again, it's rarely actually just carpal tunnel.
So, well, I guess I have some questions about when we get to what you think the main cause is in your neck. If you have this neck problem and you are displaying carpal tunnel symptoms, does that mean that your neck problem has severely progressed if it's reaching the whole way down into your hand?
So that's a good question. No, this is kind of what happens. So in general, yes, the further down it goes, the worse it is-ish. It's more worse if it goes from pain to tingling to numb to weak. So that's the way nerve damage will progress, okay? The nerve signal, you were putting pressure on the nerve, it hurt, okay? You were able to pull away, it stopped hurting. You were putting pressure on the nerve, it hurt, you couldn't take the pressure off. Eventually that nerve will damage more. That damaged nerve will go from pain to tingling to numb, and then eventually weakness. And weakness is the worst. And even though I'd much rather my hand be numb and weak than in pain, physiologically speaking, pain is better. Mm-hmm. So when you put pressure on a nerve at your neck, wherever that nerve goes will now be affected, okay? So it's not necessarily, if you're feeling it into your fingers, it's not necessarily worse, although that is often the case.
Gotcha.
But it's definitely worse if it was pain and now you're getting other symptoms as well.
Gotcha. Now, could you be displaying and feeling these carpal tunnel symptoms and maybe in the past had a neck problem but are no longer experiencing any neck pain?
So another good question. Most of the time people, they get used to their symptoms, right? Like you had neck pain and you got used to it. And used to it could mean anything. It could be that you got used to compensating for it. Instead of like really looking over your shoulder, now you kind of arch your back, or you turn at your waist, or if you're standing, you turn at your ankles, knees, or hips. You know what I mean? Like you realize that that's as far as you go anymore, turning, and you don't think that you go any further. You've kind of gotten used to your new margins of movement, right? You also get used to stimulus. If I put pressure on you and it hurts, but if I keep putting pressure in that same area, eventually your body's going to start processing that as normal. Kind of like we talk about this, you put your shirt on in the morning. When you first put your shirt on, you're like, I have a shirt on. You realize it. But then your body starts to process it as normal stimulus, so that way it can tell change, right? This happens with injuries a lot, and most people, when they have an injury or they have a problem, they really don't get it fully fixed. And this is the case for a lot of spine issues. For example, like most spine rehab is focused on core neutral strengthening. Core neutral meaning not moving. Mm-hmm. But your body needs to move. It needs to restore normal movement. It needs full movement, right? That just makes sense. To restore normal strength, it needs muscle contraction, strength in those ranges, but core neutral strengthening doesn't do that as well. And if you have a neck problem, if you have a back problem, that's pretty much the advice that you get. For the neck, you get a lot of stretching.
Yeah.
And stretching doesn't really work either for the neck.
Okay. All right, so you're out there, you're working your 9-to-5 job at the computer, you have wrist pain.
Yeah, the first thing you should think of is your neck.
Okay.
You have wrist pain, first thing you should think of is your neck. If you're out there and your 9-to-5 is jackhammering or rock climbing or plumbing or some type of machinery or something like that, okay.
Where you're like really...
Yeah, even then though, you still want to assess the neck pretty heavily because it's likely some pressure there, whether it's the main pressure or just an adjunct pressure, whatever, but either way, you might as well address it.
Okay. Well, the way you address carpal tunnel, from my understanding, is you get one of those squishy wrist things.
Squishy wrist thing for your desk.
And then you're fixed.
Okay, and now that didn't work.
So then you get the splint.
So then you get the splint
thing.
Yep. And you wear that at night maybe.
Yep.
As well. Now that didn't work. Now what do you do?
Well, you are taking your Advil during this time as well.
Yeah, and Advil's absolutely not working. So if this is nerve pain, Advil might take like the edge off a little bit.
Okay.
But nerve pain, it's more like Lyrica, Neurontin, stuff like that will actually help. But help meaning it'll numb you to your symptoms better than Advil will numb you to your symptoms.
So then I guess the next steps are what? Injections?
Injections, cortisone injections, but again, kind of temporary. It decreases some inflammation. Typically there's some pain relief with it in the injection itself, lidocaine, bupivacaine, something like that. So you get some analgesic effect temporarily, but again, let's say it is true carpal tunnel syndrome. If the tunnel has closed down, nothing you inject into that tunnel is going to repair it, right? So if it does work, it's temporary.
Okay, so now I'm about 6 months to a year into my treatment journey with carpal tunnel, right?
Yeah, all right, and during that time you've probably done some physical therapy, and physical therapy focuses on stretching at the wrists, strengthening at the wrists and arm, which never works for this. It works on maybe nerve glides, maybe some tendon glides, and then it works on like heat and stim and massage and ultrasound and laser and like all these like kind of modalities at the wrists that really don't work either.
Okay, so I'm not getting any better, so what's the next?
Now it's surgery.
Surgery.
Now it's surgery, and again, surgery for this can often be avoided, like often. Hey, just a quick break here and then we'll get back to the show. If you're out there and you want to see if this is the right approach for you, you can schedule a consult or a session with me. Go to thespinaltruth.com. At least set up a consult. Within 30 minutes, I will listen to your symptoms. I will go over your history. I'll go over what the approach I would take for you and the results that I would expect. My goal is to save you from continued pain, failed treatments, and prevent you from getting surgery. So go to thespinaltruth.com, set up a consult, and let me go over your symptoms. Now let's get back to the show.
Well, I get the surgery. Is there a chance it'll make my pain and stuff go away?
There is a chance, there's probably a high chance it'll make your pain go away. Again, like if you had concurrent pressure, let's say 80% of the pressure was at your neck, 20% at your wrist. If you relieve that 20%, you should feel better, right?
But will it return?
It'll likely return, yeah.
Interesting.
Yeah, and again, for a lot of people, it'll return. For a lot of people, it will switch sides. For a lot of people, the surgery itself won't have helped.
How long is the recovery for the surgery?
Really quick.
Oh, okay, good.
Yeah, like...
I
mean, like you're back to work on Monday for the most part type thing. But, I mean, two weeks out, you should be pretty good to go.
Okay, so I've wasted thousands and thousands of dollars.
Lots
a year plus of my life.
Yeah, lots of time.
Lots of time.
Lots of, like, physical headache, so to speak.
And now I've had the surgery, and now my pain's starting to come back.
Yeah.
So what do people normally do then?
Might have the surgery again.
Wow.
Might just deal with it. Might just do injections and medication.
For the remainder. Until it is what it is. Okay. Or
you can try your neck.
What can we do with our neck?
Well, All right, and for the people at home too, the first thing that I do if you come in, and this is what anybody should do if you have this problem, is they should ask you questions about your hand, and they should look at your hand. Okay, so it's not like you come in and you say my wrists hurt, and I'm like, okay, we're only going to look and talk about your neck, right? You come in, you say my wrists hurt. I want to know when, for how long, when, how bad does it get? What are the symptoms? Where are the symptoms? Is it is it on both sides? Is it which fingers? What do you do that makes it better? What do ask all those questions. Then I want to take a look at your hand movement. How strong is your grip strength? How, when you move your hand certain directions, do you get symptoms? Then you want to look at the neck, the correlating area of your spine, which is C5, 6, 7, nerve root, C8, and then T1.
Okay.
So it's your mid-neck, upper back. You want to see if there's any type of stiffness or pain, especially to palpation, or any symptoms with movement or limitations of movement. If you find anything, then you want to treat this. And after you're done treating it, even in the session, you want to look back to your hand symptoms that you were able to reproduce or measure, if one of them is weaker in grip strength versus the other, blah, blah, blah. And you want to see if it changes. If it changes, great. Now you know.
Effect,
now you know working on the neck has an effect. Let's say it doesn't change. Maybe you give it another visit or two. If it's still not changing, then work on the rest.
Yeah, I think like the grip strength and stuff like that's something that provides a data point that you can compare to, as opposed to a subjective feeling.
That's the biggest thing of trying to find on a visit, because a lot of times these are like let's say I magically waved a wand and took pressure off your nerve right now, right? It might take a few minutes to days, maybe even a little bit longer, for your symptoms to start improving. Okay? It might not. It might improve right away. But that's the hard part during the visit, is trying to find something that the patient can reproduce, move, get into a position right away. That right there, that hurts, that's my pain. Right here, that's as far as I can go. I can't go any further, right?
Yeah.
Something that I can see, something that the patient can see, and then coming back to that, and that's very valuable, and that's part of what the initial evaluation is for, is to find that.
Okay, so then you do find some issues in that portion of their neck, and you have them do some exercises,
Have them do some exercises to move their neck around, take pressure off the nerve, restore nerve mobility, strengthen in that range, and then there you go.
Okay, so once you do that, and my wrist is starting to get better. Now I go back to work, I'm typing away, my wrist pain comes back.
Then you know immediately what to do. You know what exercises take pressure off that nerve. You sit up, you do a few of your exercises, you should be good to go.
Now, is there the ability to, I want to say cure, but have a longer lasting effect, meaning you do your exercises for a while, or you strengthen part of your neck, or?
Yeah, absolutely.
Okay.
And it's how much pressure you put on and how long you've had pressure off, right? And like how strong and mobile you are in that area. So the one negative about this is that you'll do your exercise, you'll take pressure off, but then you go back to doing what put pressure on in the first place. And for us, that's sitting, and for us, that's like 90% of our day.
Yeah.
Right? And even if you're not sitting, if you are standing, you're often looking down, like doing dishes, reading the mail, reading, gardening. All of this, you're
using
looking down.
Yeah.
Standing, using your phone, you're looking down, right? So even if you're not sitting. So the problem is that you'll probably, it's like I've had instructors that they'll give you your exercises and compare it to like a bank account. Like, look, every time you do this, that's $1 withdrawal. So you have to do this, which is $1 deposit, right? And you have to, at the end of the day, you have to be even or above, right? And if you do that for a while, and a while, it depends, like 4 to 6 weeks for most of these people. If you do that for a while, you should be able to get yourself to a place where you don't have to do it as often.
Gotcha.
So like this is something that honestly, it should be taught in schools. There's certain things that like to take pressure off your neck and shoulders. I have my kids do the foam roller in the morning and another exercise before they leave and when they get home. Now, we definitely don't do it every day, and they definitely struggle against me in order to do it. But I think it's very helpful because they're going to go to school and they're just going to look down for 8 hours.
Yeah. So what about the people who are out there who don't really know. They're not officially diagnosed with anything. What does this feel like, this wrist pain? Is it burning? Is it shocking?
So the problem is with nerve pain, it can be anything.
Gotcha.
Okay? Most of the time, it's more like a pressure, a fullness. There's some pain. The pain is more electric-like. It's more like tingly. It's more nerve-like rather than it is like a muscle pain, where muscle pain's more of like a gnaw, more of like a deeper focal. This one's more diffuse. It comes and goes. It comes kind of quickly. It feels like a bunch of symptoms. It feels like pain. It feels like weakness. It feels like heaviness.
Could you get like that kind of quick stabbing sensation?
Could get like a quick stabbing, a quick jolt. Yeah, it could feel like arthritis.
Okay.
It could feel like it's always in a joint. So like it makes sense why it's so missed, but it shouldn't be if we all practice this way and we all had a little bit more time in order to diagnose. Like, one of the problems is you go to the doctor and how long do you think the session lasts to diagnose you with carpal tunnel?
5 to 10 minutes.
5 to 10 minutes, right? That's not a lot of time to do differential diagnosis, to ask you about symptoms into your pinky, to evaluate, your neck movement, to possibly even treat your neck and see if it changes your hand symptoms, to get to all of your history. That's as well as to examine you, as well as to then give you the information from the examination, which is your recommendation for treatment, and then to educate you on that. Like, again, even just taking a pill or an injection, you normally have to tell the patient, you have to double check to make sure that they're appropriate for this medication, tell them what to expect, order it, deliver it, and all this happens in, a 5 to 10 minute session.
So let me ask you this then. If you've been diagnosed with carpal tunnel and you're like, supposed to get a surgery, if you did these neck exercises for a week or two, would you see results if it's coming from your neck?
Absolutely, yeah.
And that would maybe...
I would say almost anybody. I would say the large majority of the people, I would advocate you give it 2 weeks. So if somebody comes to me and they say, I've had carpal tunnel, it's not going away, my next step is surgery, I'm going to schedule surgery. But they want to see me for my opinion or whatever. I'll say, fine, schedule the surgery. If you want, schedule it out for whatever, 3 weeks from now. Give me 2 weeks. Give me 2 weeks of following what I'm saying. If we make a dramatic effect, then you have your option of you can go through with the surgery or you can cancel. It's up to you.
All right. So I find it strange because we get so much pushback on some of these things. We were just talking about this morning, like a comment about talking about the symptoms that you have that mean it's not carpal tunnel. And it's just like a mocking of that. And I don't understand the mentality when all we're asking is try some of these neck exercises. It might have a dramatic effect. You might avoid surgery. And if it didn't have an effect, then you still have your options. Yeah, the
right?
option of,
You can still do the same treatment that's not going to work and lead you to surgery anyway.
Yeah. Well, I mean, maybe they do have legitimate carpal tunnel at that point too.
Yeah, maybe they do. Again, it's a lot rarer than we think. It's frustratingly rare.
But at that point, you've ruled out neck component, potentially, if you're doing the exercises consistently and all that stuff. And so now this option, to me, makes more sense.
Right. And let's say it was just at the wrist. You moving your neck around and having a more mobile, less pressure on the nerve neck, even if it wasn't really pressure at the neck, should actually help you for your recovery for your wrist. I know that sounds odd, but again, it was irritation, compression in the median nerve. The median nerve, to say it simplistically, starts at your neck, comes out of your neck, right? So if there's pressure on at your neck or if there's tension at your neck, that can add to that tension at your wrist.
Yeah.
So it's not 2 weeks lost. Even if you did those 2 weeks and it's not any better, it's not 2 weeks lost.
Well, I would think the majority of at least Americans in their lifestyle would benefit from just doing that foam roller exercise.
Yeah.
Just because our lives, everybody looks down at their phone all day or at the computer, sits at a computer. Way longer than they should.
Way longer, right?
And so,
I'm talking about myself too. Like, I'll get caught in like a 45-minute TikTok. And you're like,
Yeah.
you're like, wow, 45 minutes went away. And you're like, well, it's 30 minutes till I do my next thing, so might as well just
stand here and yeah. All right, so it sounds like there's some options out there.
If you're listening to this, and we probably should have said this earlier on, we made a carpal tunnel series. It's free. It's on our TikTok channel. It's on YouTube, right? If you go to TikTok, it's on our homepage, where the playlist tabs, which I don't think anybody knows.
Nobody knows.
Yeah, there's a whole bunch of playlists there. And
why don't you ever tell us what to do?
Series. Right. Or people that are like, you never show exercises. I'm like,
there's a million.
Yeah. There's a million exercises just waiting there.
Yeah.
So you have that on YouTube or on TikTok. I don't know how to find it on Instagram.
Instagram's a little different because we have that whole little neat thing set up. I wouldn't use Instagram, honestly, for these. I think your best is YouTube, because of the playlist functionality of it and it being very specific, or TikTok.
So it talks you through pretty much what we just talked about. What is and what isn't carpal tunnel, why it gets misdiagnosed, but then it also offers some exercises to do that should make you see a difference. It's not the complete, what I would do, but it's definitely a really good start. And there you go. If you want to see me, you can go to thespinaltruth.com. You can set up a consult. You can, or you can set up a visit. And then we also have a paid course. If you can't see me, you want a little bit more than the free course, we have that's available on our website, spinaltruth.com. It's $99. It'll take you through treating your neck, which will treat your hand.
So we have the arm treatment course and the neck course. So you think if you have carpal tunnel, they should check out the neck course?
Either one would work.
Okay.
But I'd probably still go with the neck course.
Neck course. Okay. And maybe down the future we'll do a specific
carpal tunnel one, yeah.
Awesome.
Yeah.
Should I keep my squishy thing for my wrist?
I don't think so.
Really?
Yeah, I don't think so. No squishy pad. You know what, though? If you like the squishy pad, keep the squishy pad.
I feel like I'm so used to the squishy pad at this point.
Who cares, right?
Yeah.
But I always thought it was funny because they're like, it's pressure at your wrists. But if you don't have that squishy pad, most of the time there's not a lot of pressure at your wrist. Getting the squishy pad puts more pressure on your wrist.
Yeah,
it's just squishy pressure.
Yeah.
But it's still more pressure at your wrist. So I always thought it was funny. It was like, the problem is pressure on your wrist, so we're going to give you something to put pressure on your wrist.
Yeah. All right, carpal tunnel. It sounds like that's honestly one of the more simpler things to kind of figure out.
It is simpler. It is easy, and it's often misdiagnosed. People would be surprised.
Well, I want to leave your comments down there. Let us know if you have carpal tunnel or have been diagnosed with carpal tunnel, how long you've been dealing with it, what you've done so far. Because I'm interested to hear other people's stories and see if they've gone through all this rigmarole or.
I think it's going to be 90% of them will say what we said. Maybe not that high, but let's say 70% of them. 70% of them will say, I did everything that you just mentioned. The splints, the stretching, the nerve glides, the hot pack, the changing my work desk around, injections. Nothing really helped. The injections helped temporarily, and then it came back. All right, that's our show. Hopefully we gave you some information you didn't have before. Please make sure to follow us on TikTok, Instagram, YouTube, and we are also on Spotify for this podcast.
Yep.
If you have any medical questions, if you want to make an appointment with me, you can go to thespinaltruth.com and set up a consult or a session. If you just want to keep hearing our take, which is a little bit different on the medical world and what the symptoms, how they're getting diagnosed and how they're getting treated, stay tuned for next week.
Also, we'd love to get comments if there's something we haven't talked about that they'd like to hear us talk about.
Yeah, that's a good one. If you have something that we haven't talked about and you want to hear about it, leave a comment. We'll do that episode.
Yep.
All right. See you next week.